Everyone feeling today? All right, cool, looking alive, very nice. My name is Liana Sananda Giluli, and I'm very excited to be here having this conversation here at the New West Summit, and I'm grateful that all of you have chosen to join us. So I'd like to start out by just introducing our fine panelists here, and also saying that two of our panelists were unable to make it today. They are standing in solidarity with the Marriott protesters who are on strike, and I just wanted to acknowledge that and acknowledge them. I spent some time this morning outside having a conversation with a few of the strikers and trying to understand a little bit better what they're asking for, and I would encourage all of you to do the same and ask yourself what's something nice that you can do for them while you're here. So with that said, I'll start by sharing a little bit about myself. I know a lot of you in this room because I spent several years working with the ArcView group, who you might have heard of. ArcView runs a very large cannabis investor network. And so from there, now I currently work for the Multidisciplinary Association for Psychedelic Studies. And so MAPS is the acronym, is currently doing is in phase 3 FDA trials with MDMA assisted psychotherapy to treat PTSD. And so we're looking at FDA approval as soon as 2021 for that. So it's a very exciting time in this field, this emergent field of psychedelic psychiatry. And also in addition to that, I co-founded a nonprofit with Dr. Martin Polanco, who is the other doctor who couldn't make it today. And we are working with Special Forces veterans. That nonprofit is called The Mission Within, and we're treating Special Forces veterans who are suffering from traumatic brain injury using ibogaine and 5-MeO-DMT at centers in Mexico where those treatments are legal and available. So that's a little bit about me. To my right over here, we have Michelle Janikian, and she's a journalist focused on drug policy, trends, and education. She's a staff writer at Herb magazine and a columnist for Playboy. Her work has also appeared in Rolling Stones, High Times, Teen Vogue, and others. She's passionate about telling inspiring medical cannabis and therapeutic psychedelic stories, as well as educating the public on the science behind the medical benefits of these criminalized substances. Her work has led her to speak with many people whose lives have been radically improved by cannabis and psychedelics, such as psilocybin, MDMA, and ketamine, and as well as doctors and researchers working in the field. And she's honored to help change the narrative and public perception around these substances one story at a time. So we have Michelle. And then to my left, we have Dr. Sue Sicily, who I think many of you might also know. And she is an Arizona-based physician practicing internal medicine and psychiatry. Sue serves as president and principal investigator of the Scottsdale Research Institute in Arizona. They conduct controlled trials of smoked or vaporized cannabis flower, striving to move whole plant dry flower through the entire FDA drug development process. Dr. Sicily is the principal investigator for the first and only FDA-approved randomized controls trial in the world examining the safety and efficacy of whole plant marijuana in combat veterans with treatment-resistant post-traumatic stress disorder. She's worked as an independent medical director for medical cannabis license holders in 17 different states, from Hawaii to Florida to New Jersey, developing tools and patient education and physician engagement. So this is Dr. Sue Sicily. And I think, yeah, please, big round of applause. Yeah, so in lieu of some absent panelists, we're kind of looking to have more of a conversation with each other today. Some of the doctors here are representing some of the MAPS work, and I'm quite knowledgeable about that, so I'll probably be speaking more than I had originally intended to. And I think we'd like to start by giving this sort of update on the work that's happening here. And I'd like to start by Sue just talking a little bit about some of the work that is happening in MDMA-assisted psychotherapy and how it relates to the work she's doing in cannabis.
Thank you, Liana. I'm so happy to have so many folks here. I didn't expect this kind of turnout. Thank you for coming. I've been really grateful to work with MAPS now for about 12 years, and I've given the opportunity to kind of compare our cannabis research to the psychedelic research and see how the evolution of this work, how things have changed, how the barriers continue to be impeding a lot of this work. I think what I've been most impressed by is that even though we agree that cannabis doesn't belong in Schedule 1 and it's absurd that it's lumped in with Schedule 1 in the first place, the fact is that cannabis is the hardest drug to study in Schedule 1. It's much easier to study MDMA, LSD, psilocybin, because cannabis has been struggling with several additional layers of government red tape that have caused it to be, blocked for so many years. So because I've been looking in MAPS, I get to compare the two. And for instance, right now, we're still doing an FDA phase 2 trial with cannabis, and yet here with MAPS's MDMA research, they're already at FDA phase 3 trials. And so I wanted to give you a glimpse of the work that they did in phase 2. So you can see here what I've been impressed. I mean, I'm certainly really passionate about our cannabis research, but I'm equally impressed and fascinated by the data on MDMA. And in many cases, MDMA is far more crucial as a treatment modality. You can see here this data from phase 2 showed that 83% of the subjects received, after just 2 to 3 MDMA sessions, had no detectable PTSD at the primary endpoint, which is really, when you think about the way we view cannabis, is really more for symptom control, right? With PTSD, we know that when patients use cannabis, they get better, relief of their symptoms, but it rarely does it make their PTSD go away, right? It doesn't put them into remission. Yet with MDMA-assisted therapy, they're actually, going into full remission in many cases. So this is really compelling. I'll show you, this is the actual, so this was published in Journal of Psychopharm. This is actually worth reading if you want. This is available for free online. This was published back in 2012. But you see that 83%, that's, none of the standard medications that I write for patients every day would ever be able to achieve that kind of remission data. And here you can see here, so before treatment, the severity of their PTSD was sky high. 2 months after treatment, dramatically reduced to actual statistical significant reduction in symptoms, and then even almost 4 years later, their PTSD continued in remission and often even got better over time. So it's not like with standard pharmaceuticals, right? You wouldn't expect that. You wouldn't see this kind of continual reduction in PTSD over time. And here you can see this is another look at it. Before treatment, then with the number of subjects that qualified for PTSD, you can see how much that dropped with the MDMA-assisted therapy. And then comparing with psychotherapy alone. Now, the VA says that psychotherapy alone is the gold standard, but you can see how few patients are responding to CBT alone, but yet with MDMA. So MDMA is catalyzing some really incredible relief of suffering, and that's why I'm so proud to be associated with them. And I'll just show you real quick. This is the most recent data. I'm sorry, it's a little blurry, but you can see here that basically this is an N of 100. So they looked at 100 subjects, and there were 56% of the subjects no longer met criteria for PTSD after just 3 sessions with MDMA. And then they did a 12-month follow-up, which is usually when you see people start to trail off, the efficacy starts to wane. But in fact, at their 12-month follow-up, they had even more robust data where 68% no longer met PTSD criteria. So it's incredibly exciting. And you can see here, this is their, we're gonna talk more. I wanna let Liana take control again because I want her to, we're gonna walk through a lot of discussion now about what the value of going through the FDA regulatory pathway and all that. So let me hand it back over to her. Thank you, guys.
Yeah, thanks so much, Sue. I just wanted to also add that there's some other exciting things that have come with having such profound results. For example, the American Psychiatric Association, which is the largest organization of professionals working in the field, just this past August at their big annual conference, ran an entire morning session all on psychedelic psychiatry, which goes to show that we're just seeing results here that are unheard of. There's not, the FDA declared MDMA-assisted psychotherapy a breakthrough treatment for PTSD. That's a special designation that less than 1/3 of drugs being developed through FDA get. And the reason why they did it is, and there's been no treatment that's received that designation in 30 years, not since the invention of SSRIs. And so it's gaining a lot of very professional people all over the world are now reaching out and very interested because let's face it, we're in a mental health crisis here on our planet. I mean, depression is the #1 cause of disability globally. There's over 300 million people who are suffering from that, and it's continuing to be compounded by all sorts of factors. And so people who are serious about the field of psychiatry are looking towards psychedelics and understanding that this is a new lens to understand the mind through. And so there's a very sincere exploration that's been happening here, and we've been extremely supported by the FDA, which has also been this fascinating process of working within an established governmental framework. And the fact of the matter is that it's very likely we'll see FDA-approved access to psychedelics ahead of any FDA-approved access to cannabis. And so that means that we'll have federally legal, and also it's important to note that we're not talking about recreational access, we're talking about administering psychedelics in controlled environments. So the MDMA protocol is a male-female therapy team, and it's overall 40 hours of therapy. So there's 12 90-minute sessions that are preparing you for the MDMA-assisted psychotherapy session, and also doing the integration work with you as well. So it's about the preparation and the integration as much, or in some cases even more, than the journey itself. And then the 8-hour session, this is a deep dive therapy session. We don't see any therapist on the planet sitting with a patient for 8 hours. And so just that in itself is a massive breakthrough. And it's really about the psychedelic's ability to potentiate the inner healing that each person has their own inner healing intelligence. And so it's not so much about the therapist coming in and guiding you or directing the session, but more about empowering the individual to heal themselves and be resourced in that. And so it's an entirely new method of psychotherapy as well that's been developed in conjunction with psychedelics. So it's a very exciting time in the field of psychiatric medicine. So I just wanted to mention all of that just to add on to what Sue was saying. And I've prepared a bunch of questions, and really what I want to sort of kind of begin with is asking both of you, why psychedelics? Why should we care? Why do you care? What have they meant for you in your life? And why is it that you think we're talking about psychedelics at a cannabis conference?
Well, I can take that one first. You know, I've been writing about cannabis for only about 4 years, but you know, I really do feel like a natural progression for me as a journalist is to start writing about psychedelics. And sorry, can I just But a really big part of my job is to interview people who are using cannabis and CBD for health issues. And I tell their story in a narrative way where I explain what was wrong and how cannabis helped. And I'll interview doctors and explain to the public, you know, what's the science behind what's going on? Why is this girl with alopecia's hair growing back? Because she's taking CBD. And so for me, that little niche of journalism really lent itself well to telling psychedelic stories. So I've started interviewing people, you know, vets with PTSD, suicidal people with treatment-resistant depression who were at their last leg. You know, they had no other options, and they're trying psychedelics. They're going to ketamine infusion clinics, which are legal currently with off-use of ketamine. But they're also, I'm not always talking to people in the clinical trials. Sometimes I'm interviewing people that are taking mushrooms at home for introspection and trying to heal and move past trauma from PTSD. So for me, just telling these people's stories has been such an honor, and it really feels like, in a way that only psychedelics can do, that I was like meant to tell these stories, and that they're all connected somehow, and it's really just so inspiring. So I just feel really honored to help tell them and to help change the narrative in the public opinion as well.
That's a good point. I want to touch on that too, because we're so lucky to have journalists that are willing to help translate these stories to the public. It's been, so tough because a lot of these plant-based medicines and psychedelics have been vilified for so many years, and having you being able to tell real human stories about how people are responding and how they're in many cases able to get off much more addictive meds. And Willie G was telling me earlier he was able to get off opioids using psychedelics, and we have all these incredible anecdotal reports, and it's really crucial that we keep the science moving forward and get as much published data as possible in order to change laws and be able to create, a more empathic community. So I really appreciate the fact. That's how I learned. I've actually never taken psychedelics, but I've been taking care of military veterans for 20 years in my medical practice, and they've taught me about their the vast diversity of experiences they've had with all sorts of psychedelics, and I was really judgmental, and I'm trained in a really conservative medical model where we don't view anything as medicine unless it's been put through the entire FDA drug development process. So it was really hard for me to wrap my brain around how this could be medicine, and then slowly seeing you just can't ignore the mountain of anecdotal evidence that has been piling up over the last several years, and patients coming to me talking, their family members talking about how they've been transformed, how it saved their life, and you just can't be human and not be moved by these stories. So that's how I got involved with MAPS. I was looking for a mechanism to engage with real science, and I know we're going to talk more about that.
Yeah, well, thanks, Sue. I'd like to, so speaking of stigma and the shifting of stigma, how do you ladies think that the cannabis movement has added or detracted, or what do you think that relationship is in terms of shifting the stigma around psychedelics? Like, has cannabis helped us?
Yeah, I think that, this panel is called The Next Frontier, right? What's after cannabis? And I do think, although the cannabis industry does often like to stay separate from psychedelics because there is a lot of stigma against them, that without the current legalization efforts, legalization in California and other states, and destigmatization around the whole country, like 64% of Americans believe cannabis should be legal. I think that has helped open the door for people to be more open to, for me, other types of stories, but for the public, open to other options for mental health care. And I think cannabis has really helped progress the public's opinion on these subjects, on these substances.
Totally. So I'm just gonna dive into this question here that I think a lot of us are facing right now as the psychedelic movement and the psychedelic research movement has really started to gain traction. And so now we're seeing the first for-profit companies have formed in the space of psychedelics. And so we're starting to see people preparing for creating an industry which is currently in a totally virgin field, which is very interesting because this has happened in cannabis, and so we're asking a lot, we're taking lessons and we're looking at cannabis saying, okay, what went right? And also importantly, what went wrong? And so there's sort of two questions here. One is, how can the scientific community seeking to prove benefit keep the social justice movement at the core of reforming drug policy in mind during these investigations? And also, what does creating access for all, especially those who experience a disproportionate amount of trauma and don't have access to normal mental health services anyways, look like? And what are the systemic issues that are at the core of this, and how can we avoid perpetuating them? Yeah.
I think I'll start. I think the most crucial thing is going to be getting these different medicines through the entire FDA drug development process. That's the first step to creating meaningful access in in a lawful environment, because there's a lot of folks who need this medicine and will never even put their toe in because they are afraid to do something that's illegal. So trying to get it through the entire FDA process, get it rescheduled, hopefully, with MAPS, getting MDMA, once it gets through phase 3, if the data is compelling enough, the FDA and the DEA will allow MDMA to be rescheduled. And hopefully ecstasy will also be, the recreational form would also be rescheduled with that, but we don't know. Sometimes, we've seen other cases where they haven't done that, with Xyrem and a few other meds where they just rescheduled the prescription medicine and didn't reschedule the original drug. But I think that's the goal, is just trying to then, once it gets through the FDA process, then to create mechanisms for all people to get access, whether they have health care or not, maybe creating some kind of nonprofit foundations that would raise money for people, because this treatment is going to be expensive, right? Whether it's MDMA-assisted therapy or LSD or psilocybin-assisted psychotherapy, all of these medicines and psychotherapy, because they require such a structured, intensive psychotherapy with this male-female therapist, this co-therapy model, it's not going to be cheap, because you got to pay folks to sit for whatever, 8 hours, 10 hours, and be able to guide patients through this process. So that's more expensive than a traditional pharmaceutical where you're just taking a pill or a capsule and just just paying for the pill itself. So there is we're gonna have to think really hard. And I think that this is really important, that MAPS and these other companies that I'm not in favor of these giant corporations, these greedy folks coming in and trying to wield power over natural medicine, kind of plant-based medicines. But in the end, I think it is helpful when we talk about destigmatizing. If these guys can usher through patented forms of psilocybin and start mainstreaming the discussion about psilocybin and LSD as medicine, I think that's valuable, and hopefully we, as then the psychedelic community, can push for mechanisms that will allow for access to all and make sure that we have treatments that would be paid for in a nonprofit realm.
Yeah, I'll since Gregory's not here, I'll kind of add a few things to this question as well. Well, first of all, MAPS is a nonprofit. It's one of only a very few nonprofit drug development organizations in the country, and it will be the second nonprofit to push a drug all the way through the FDA process in the history of this country. So that's pretty interesting, and And so MAPS has also filed something called a public benefit corporation, or a B Corp. And when we went and filed the B Corp, it's a third-party auditing platform that basically says that your fiduciary responsibilities prioritize public benefit over the maximization of profits. And so then you get to define that, and then this third-party association holds you accountable. So we went to them to file a B Corp pharma company, and they told us that no one had ever done that, and they didn't have a scorecard for us, which says a lot about our pharmaceutical industry here in America. So it was very interesting for us to also get to now work with bioethicists out of UPenn to develop the scorecard for pharmacos that can be used for all other organizations that seek to do drug development in a similar vein that we're working on. And so we have the Benefit Corp. We're going to be the sole manufacturer of MDMA for 5 years once it comes online, due to something called data exclusivity. And so what we're hoping to do is build, so the sole investor into the B Corp is the nonprofit, and then the sole beneficiary of the profits of the B Corp will be the nonprofit. So we've last year raised $26.9 million to fund from donors, from individual donors, to fund the phase 3 research, which is absolutely unprecedented. Yeah, and so we're looking forward to the time where we can start to build a regenerative system that can then fuel more research. And so we're actively trying to solve this question of how to be a responsible actor and be able to impact even just a fraction of the millions of people who are suffering. And so another thing that we are taking into serious consideration is that we looked across and we saw that the vast majority of our trained therapists and the vast majority of our study participants are all white. And so we are now doing, one of our study sites is focused on racial trauma, and it's with Dr. Monica Williams at University of Connecticut. We have 17 different research sites established for our phase 3 multi-site trial. And so they're specifically focused on racial trauma, and we're doing a training that's focused on training therapists of colors with the idea that the way to be able to create access to more people is by going to the people who are serving the communities that we're seeking to help and inviting them in to come take the training, come learn about this protocol, and then also give us feedback, because there might be, in this practice of being culturally competent, there might be some tweakings to the trainings and to the protocols that we need to do in order to be more suitable to certain communities. And so we're actively engaged with this process and this work and seeking to develop methods to try to resolve some of these issues. And at the same time, we're very well aware that MAPS is going to scale at a very controlled rate. MAPS will not be capitalizing on the business opportunity that we're creating. We're going to retain the core of what we stand for and what we're doing. And there are these other players coming in now that want to establish clinics and want to file patents. And it's been this big conversation. There's this open sciences and praxis statement that was published last May and signed by nearly every psychedelic researcher on the planet, including like Ram Dass and just like everyone who's ever done research. And what they said is that that the community's committing to not filing any patents that could be prohibitive and preventative towards the research, and also committing to share research data. Yeah, we're gonna leave lots of time for questions, so yeah, cool. So I just wanted to mention all of that because, I worked at ArcView, and I have to say that it's been really challenging to watch the way that some of these things have developed and ended up panning out, and watching people I know who have grown cannabis for like generations have to fold their businesses and have to just completely shut down. And so I think that there's ways to address this, and I think that people in the cannabis industry are really concerned about all these issues. And then also, we're inextricably tied to the war on drugs. And that's something else that, we've lost funding. Funders have come to us and been like, we just want you to focus on science. And our executive director, Rick Doblin, who is just an absolute hero and legend, has said, no, this is political. We're not going to just focus on science. We're going to continue to advocate for ending the war on drugs and decriminalizing all drugs and creating safe access. And so, yeah. So that's another thing that we've been focused on. And so I think it really comes down to really asking ourselves who we really are and how can we illuminate our blind spots, the things that we aren't seeing, and how can we involve more communities. And it's definitely a work in progress, but I am very proud of the certain things that MAPS has done to set us up in this way. So
I think too, when you talk about racial trauma, I hope that we do a better job of reaching out to the Native American communities, because in Arizona I interact with 24 different federally recognized tribes, and we see the effect of trauma on them daily. And I think they're really frustrated that the psychedelic community has sort of moved forward without a lot of input from them, even though this is really their regular part of their ceremony. It's their sacrament, and we haven't really figured out a way to honor their viewpoint. So I'm hoping as we keep, get them involved.
Okay, yeah. Well, I'll just say something to that point as well, because that is such a contentious thing. We're taking the sacred and we're putting it into the scientific, reductionary Western framework and breaking it down and measuring everything. And it's antithetical to the relationship and to the ceremonial settings that so often for thousands of years people have been utilizing these plant medicines to heal themselves. And so I think this is a very important and critical question. I also want to highlight that, well, first of all, there's only going to be two ways to access psychedelics legally in the foreseeable future. One of them is through this medical context, And then the other way is through the religious use. So we have the religious use laws. There's currently we have the Native American Church, and they serve peyote in San Pedro, and then we have 2 different ayahuasca churches filed in the United States where you can legally go and sit ceremony in that context. There's also been a church that was recently filed for 5-MeO-DMT. And I know that there's an effort being made right now by a group of Iboga practitioners to bring that tradition into the United States as well. And so while we're doing all of this medicalization work, there's a tandem movement happening right now, and we're very much connected, but there's certain places where we kind of have to separate. And they're kind of like 2 sides to the same coin, so to speak, but we're all working towards the shared goal. And so it's definitely important that we continue to open this dialogue and invite perspectives that aren't different from our own. Yeah.
That's a good point. Yeah, we were talking earlier about the problems of recruiting patients for clinical trials and how most of our patients, whether it's cannabis studies or psychedelic studies, are mostly Caucasian patients, and it's been really hard to, no matter how much, even though I'm surrounded by all sorts of Native American tribes who could have joined into our current cannabis trial, and we just couldn't bring them in. And so we have to find better ways to make sure to grab these folks by the hand and lead them into study so that we can learn from them, because like we were saying, that it's going to be tough later to know there's certainly going to be unique cultural aspects to how Native American population is going to respond to MDMA or LSD versus Caucasian, Hispanic. So we want to be able to capture as much data as possible and learn from that and publish it so people know what possibly unique reactions they may have to this process.
Yeah. So I would like to ask kind of a question to wrap up, and then we're going to leave at least 20 minutes for questions, because I'm so curious too. I'm like, I don't know what you all want to know or what drew you into this conversation, and so we're excited to listen to your questions. But so my last question is, what impact on society do you believe the unleashing of these medicines may have? And what do you think will occur over the next 3, 5, and 10 years? And what other contexts do you envision psychedelics becoming available, if any?
Yeah, sure. Well, I wasn't sure of the answer to this question before I started writing about this. I had no idea, but about 6 months ago, I spent an hour on the phone with Rick Doblin, and I learned so much. But first of all, like, his vision as he explained it to me and maps his vision is to really integrate psychedelics into society, to not make them like accessible, but accepted by the general public. And he told me that he believes by 2035, so that's more than 5-10 years. But, still in most of our lifetimes, he thinks that, everything from psilocybin-assisted hospice centers where you can trip, on your way out to be more accepting to death, because there's a lot of studies coming out, that are showing that end-of-life anxiety is greatly decreased by these psychedelic experiences. But he also believes things like MDMA couples therapy, and our mental health system, like we keep saying, is quite broken. A lot of people are suffering, and they have treatment-resistant depression, PTSD, whatever, and the traditional medications aren't working for them. So I think that there's going to be a psychedelic option for everything. That's how I see the future. And hopefully less prescription drugs.
Yeah. I agree. I hope that we can, first of all, change the scheduling of these drugs so that, and only through data, through these controlled trials, will we be able to persuade FDA and DEA to do that. Hopefully someday DEA won't have a role in making decisions about the medical properties of these drugs. It's absurd that they're even involved in this, and we're trying really hard to create a scenario down the road where it would just be FDA and people who actually understand healthcare and care about that would be in charge of those decisions. I agree. I mean, one of the things that gave me a lot of hope this year was the federal government passed the right to try law, And I've spent a lot of time studying this to see if I have I do a lot of palliative care, so I take care of a lot of patients in hospice who I believe qualify for access to MDMA, cannabis. It's basically the right to try law. For those of you who are not aware, right to try law was passed in 30 plus states by the Goldwater Institute. Ironically, they were, advocating for this because they were trying to create a mechanism for terminally ill patients to make an end run around the FDA and get access to drugs that are currently being investigated. And what happened was the state laws weren't very effective, and so finally back in, I think, March of last year, Trump signed federal right to try, which now means that all patients who are deemed either terminally ill or have a life-threatening illness should be allowed to get access to anything that's under investigation. So that would include anything that's in FDA phase 1 or phase 2 trials. So should include MDMA, psilocybin, cannabis, which we're doing an FDA phase 2 trial. So I'm hoping, I just bring this up because I'm hoping this will enable, if some of you have patients that are in that category where maybe they're in hospice already or a loved one that you'd like to look at this, let me know, because you have to go through a physician who has a DEA Schedule 1 license, and I've already made it clear to everyone that I'm happy to write that letter to these drug companies to encourage them to make this available. So in the case of cannabis, unfortunately, you'd have to go through the federally legal drug supply at NIDA through the University of Mississippi for MDMA. I'm hoping that we would write a letter to MAPS, since they're the ones manufacturing for these FDA trials, and for psilocybin, go through Compass or another one of these companies. But I think that it's an important step. I raise this only because I think trying to work through these pathways will help us gradually normalize this. The more and more patients that they see, when people see their own loved ones using psilocybin at the end of life to deal with what Michelle talked about, this existential anxiety that people face at the end of life is so brutal. There is nothing that we can give in conventional meds that really helps that. I can give people benzos and opioids till the cows come out, and we're not going to get them any relief. And so I really want, the data on LSD-assisted therapy for end of life and MDMA, it's just so impressive that I hope that we can make that more widely available and then start to create more of a public groundswell to push this momentum forward. So, and also, I think what Liana mentioned earlier about the trials will also, the MDMA trials will allow for expanded access clinics. And so that's something we've applied for in the Scottsdale Research Institute. We hope to be a site for expanded access. So, for example, I think a few months ago, the MDMA trial in LA, they announced that they would be taking inquiries about who wanted to be in the MDMA trial, and they got over 1,000 inquiries in just a matter of 48 hours. You can see the demand is so high. So many people want access, but sadly there was only 20 slots open in LA. So that's why expanded access clinics are so crucial, and that's why the FDA, because the MAPS was able to get this, what is it called, the the FDA designation is called, breakthrough therapy designation, because you could see the data that we showed you was so astonishingly good that the FDA granted them breakthrough therapy designation, which is, Liana says, really hard to get. And with that, they're now allowed to provide these expanded access clinics. And I think the clinics are going to be crucial, because each of these phase 3 trial sites aren't going to be able to enroll that many patients. And there will be thousands of patients that screen out of the study, and they may need treatment, and they will be able to get them through expanded access clinics. So they don't know yet how that will work. That's something that the FDA needs to meet with MAPS and figure out the strategy for how to roll that out. But keep an eye out for that, because that will be a good way for people to utilize that treatment without having to enroll in a clinical trial.
And just to add on the expanded access, an update, if you will, from recent meetings. But yeah, so this basically means that people who have treatment-resistant PTSD can come and receive treatment ahead of FDA approval. So right now, the dates that we're looking at is June 2019, and we're looking at having at least 17, potentially more expanded access sites. This means patients, starting June will be able to come, and they'll have to pay for their own therapy, and there's some, and I'm a fundraiser for MAPS. We already have somebody who's committed $100,000 to pay for treatments for people in expanded access. So we're already putting together a fund to help people get access to treatments that could help them ahead, potentially years ahead of FDA approval. So that's really exciting. And then one thing I'll add just on the vision for the future is when I've been working on drug policy reform for a very long time, and I'm activist first. That's always been what has driven me into this movement. And I'm a big believer in cognitive liberty, the right to be able to put into our bodies and feed our minds whatever we so choose, and having full autonomy over our bodies. That being said, I've stopped believing that that the best thing to do is just to make psychedelics widely available to literally everyone on the planet. And I've started to understand the value in having a controlled rollout and creating controlled, safe environments. There's this thing we have something at MAPS called the Zendo Project, where we perform psychedelic harm reduction at music festivals. And we've done this all over the country, and we do trainings. And at Burning Man this year, we had over 400 volunteers that were holding space for people having difficult psychedelic experiences. And one of the biggest things that we teach about is set and setting. You might have heard that too when you're thinking about psychedelic experiences. And so this concept of, down the line, if we're moving towards wanting to create recreational access, and also the creating access for the betterment of well people, not just people who are suffering from something, but really understanding that psychedelics can be for the betterment of well people, how would we do that? And so one idea that's kind of been floated around is actually creating spaces where people can come and sit and have a guided experience in a safe set and setting, and then almost get a license to purchase psychedelics, and then be able to go and use it wherever, following certain rules and regulations and protocols. So down the line, I hope that we're able to create some sort of access in that way as well. But I think it will take bunches of years. The FDA is a slow and long process. MAPS has been around for 32 years, and for 17 of those years, the FDA rejected every single study design that Rick brought to them. And so it's been a really hard and tedious process. This is why it's relegated normally to massive pharmaceutical companies that usually spend $500 million on developing a single drug. So it's going to take a lot of time, but I really believe that the science is going to be the thing that really creates the massive shift that we're hoping to see. Yeah, so before we get into questions, were any other ideas or thoughts any of you ladies wanted to add? Nope? Okay. Cool. All right, questions. Sure. Maybe we'll is this microphone on? Okay. Maybe we'll hand you a microphone so you can share. Yeah.
Okay. I know that there are a lot of people that suffer from PTSD that weren't in wars. For example, during the whole Kavanaugh BS, there was triple the amount of calls coming into the rape crisis hotlines. And I'm wondering if there are any plans to include rape victims in this type of therapy. That's my first question. The second question is actually kind of a comment. I find that when I pick up a magazine when I'm having my mani-pedi, and I read that they're about hemp and cannabis in a Self magazine, if there were ways that we could get people who have experienced this healing to write to Good Housekeeping or Red Book or whatever, and get this message out to the people, and have those people then realize what you're doing is so curative and wonderful that they could then put the pressure on the politics to bring it up and get it approved faster. There should be no reason right now why the VA isn't offering this treatment for free.
Thanks for your question. I'll answer the first part. Maybe you can answer the second.
sure.
Yeah. So we've already had several victims of rape that have been involved in our studies, and so it's really open to all trauma victims. A lot of what's the media attention has been around a phase 2 trial that we did, where we had 26 participants, and 22 of them were Iraq and Afghanistan war veterans, and then the remainder were first responders, and we even had a police officer that enrolled in our study. And it's interesting because the first responders, firefighters, police officers experienced an inordinate amount of trauma on the job, but what really caught the attention, it was partially a political move, was the war veterans with PTSD, because now we're going into the heart of an issue that anyone in any red state wants to help these people, and they experience an amount of trauma that's way above the national average of the general public. But to answer your question, yes, we've already included victims of sexual assault as part of our studies.
Yeah, and actually, I wrote an article for Playboy about the subject, and I interviewed a woman, she was a vet, but her PTSD was caused by being raped in the military, and mushrooms are really helping her get over that trauma and forgive herself. She told me that after just her first dose, she was starting to learn how to love herself again, because it took her, she just blamed herself for years, and she also had a whole kind of Kavanaugh-esque experience where no one believed her, and it just traumatized her even further. But to your other point, there are major magazines picking up these stories. I want to see more, if there's editors in the audience. No. But, New York Magazine, there are some big magazines doing this. I want to see more as well. The mainstream stories are really going to help, you're right, change everything. But the problem also is that there are still a lot of journalists and media doing very sensational stories, and there's a lot of bad puns about tripping, and it still kind of stigmatizes psychedelic use. So I really just hope that more journalists, more writers start, taking this seriously. It's not a joke. It's not club drugs are saving people. I mean, yeah, club drugs are saving people's lives, but I don't know. The way we use our words, the language that we use in these articles and in the media is really gonna, if we use the right language, it's really gonna help our cause.
I think you have a really good suggestion too, because I realize that MAPS has an incredible database of devoted supporters, and we should be reaching out. They are desperate to help MAPS. They're always asking how they can volunteer, and I think we could engage them in a way and just say, hey, if you're willing to tell your stories, so many of them have these wonderful, transformative experiences that if we could encourage all of them to write about, write a blog, submit it to these different media outlets, I bet even if 1% of them got published, it could have I think you're onto a really good idea. Maybe we can share that with MAPS. And I wanted to mention too, on with our cannabis research, the veterans issue, unfortunately, our current cannabis for PTSD study did focus only on veterans, but that was a deliberate choice we made at the beginning. 10 years ago when we first started pushing and submitted the study design to the FDA, back then we didn't believe that the government would ever approve the study, and we thought the only chance we had was maybe if we focused on our revered military veterans, that would politically help us overcome these barriers. But I was shocked over and over again to see how little our government cared about these vets, and how even it took us 7 years to hurdle all of these government barriers. So in fact, even with this giant epidemic of veteran suicide that we have in this country, with this massive public health crisis, our government not only did not expedite this study, but they stonewalled it at every turn, and that was a big wake-up call to me about how little our government cares about the vets. And so in future, believe me, we will never do that. It will always do studies looking at PTSD of all causes, and vets will definitely be a big target population for us, but they won't be our only target for sure.
How much of that might be from lobbyists from big pharma trying to keep it,
It's hard to say, it's all speculation, but we are a big threat to big pharma. So yeah. So questions, maybe people can come up and grab a microphone. There's so many of you with hands up that maybe we can just Yeah, because we don't have too much time either, so we'll only have time for maybe a couple more. Yeah.
So I have a question, because I know for people that do have access to psychedelics, a lot of times, you know, once you get out of like high school or college, it's hard to find people that sell single dose psychedelics. So, you know, by the fact of like having psychedelics, you know, like a sheet of LSD is enough to put anybody in prison for a very long time. But for a lot of people, that's the only access that we have to the medicine. Is there anything on the horizon to make like all quantities of psychedelics like not criminal?
It's going to be an incremental change thing, I think. And I think the biggest thing is that when we medicalize and go through the FDA, they're required to reschedule. And so currently all of these are listed as Schedule 1, which means no medical benefit, high potential for abuse, which we just know is categorically untrue. So if they get rescheduled down, then the punishments will change associated with it. And so this is definitely going to be a very long fight.
Yeah, because I think it's important to recognize that there are massive amount of people in jail for huge amounts of time, serving time for paper.
Yeah.
And it's scary.
It is,
and,
yeah.
You know, it is something that needs to be addressed.
Definitely, yeah.
Also, aren't there some state-based ballot initiatives?
There are, yeah. So there have been some ballot initiatives to decriminalize psilocybin, and there's actually the one in Denver. Denver will actually have a direct vote to decriminalize psilocybin, which is awesome. I'm way more in favor of focusing energy on citywide initiatives. DPA did a study and found that it's more politically popular to actually decriminalize or reschedule all drugs than just focus on just psilocybin. And so I'd like for us to kind of go in that direction if we're going to do state-run initiatives. So yeah.
Cool.
Yeah, thanks.
Thanks.
Hi, I wanted to find out if there's a public benefit corporation created for CBD oil, because I know that Big Pharma is trying to grab it also.
Short answer is not that I'm aware of. And what a great idea. And, you know, if anyone can pull it off, hopefully it's people in our community and in this room that can do something like that, can consider developing drugs in that context.
Okay. The other short question I have is, are you combining treatment with auricular acupuncture? Because the VA has finally designated that as a main treatment for PTSD, and a lot of VA centers around the country use it. Maybe that's a way to bring in the MDA if you recognize that the auricular acupuncture works.
It's tough for us because when we try to combine therapy, we're doing
Yeah.
just pure drug development research. So they won't let us use adjunctive therapies because they think it muddies the what. But that's a really legitimate argument. Thank you for that.
Yeah. It's hard going through the FDA. There's very strict protocols. And so, I mean, ideally, there's also like sound therapy and even like VR therapy. And I imagine that combining them in with some psychedelic-assisted psychotherapy could increase the benefit. But it's going to be quite some time until we're able to examine that.
But the government subsidizes detox clinics around the country. I run one.
Yeah. Oh, great. Yeah, I think that's the other kind of big topic we didn't really touch on so much, but just the opioid crisis is creating a huge need for alternatives, and I think that psychedelics can really help not only heal people, and then cannabis can help with pain management, so there's some options here.
Yeah, hi. I'm just curious what you're finding in your studies that is so different or so special about psychedelics with the brain that in these treatments actually have a lasting impact. I've read that there's been functional MRIs being done on your brain. You can see all these different pathways being opened up, and I'm really curious about the science behind that, as well as the difference between psychedelic 1, 2, 3, 4, 5, 6, and 7, because there's a whole variety of different psychedelics, and like you mentioned, 5-MeO DMT, I think, and what are you studying each of those? Are you trying to study psychedelics as a general class, or are you mostly focusing on psilocybin and or LSD and what the differences are?
Yeah, I can answer this question. So in terms of studying psychedelics in general, it is true that different psychedelics work in different ways. And okay, just to jump into your first question, what we're finding is that the mechanism of how psychedelics help has to do with something. So the brain scans we're talking about is Dr. Robin Carhart Harris, who did brain scans with LSD, and he found that the prefrontal cortex is where we process. There's something called our default mode network, and that's where we build our narrative about who we are, and it's like where all our judgment kind of perceptions come of like all the information we've gathered in life to then respond to situations. And so what happens is that activity shuts down. And so it creates this like interconnectivity between all the other parts of the brain. And so there's the concept that people are kind of playing with is it brings us back into a childlike state before we've had all of these imprints, before we've like had all these life instances influence how we react and how we perceive the world and how we, understand our traumas and everything. And so, yeah, and so what that's able to do is like create this connectivity to a different part of the brain that is more in touch with emotions. And so it's like, so with MDMA specifically, it allows people to reframe their trauma and to have a different emotional response to the traumatic event. So it's like almost like creates a separation from like the information itself and gets back into the root of like who people really are, and so that they understand that they're not defined by their trauma. And so it's really interesting because the truth is that we don't really know how this stuff works. This is all just like needs more research. We're all just asking questions and having these explorations, and that psychedelics do function in different ways. So ibogaine is specifically really good for opioid addiction because it interacts with the opioid receptors inside the brain. And so people who are addicted to opiates can actually skip through all the withdrawal symptoms if they take ibogaine, because it goes and resets your opioid receptors and like clears and cleans them out. And with ibogaine as well, there's like some hypothesis around neurogenesis, and so our brain creates these neural pathways that are like habitual thinking and like the patterns of how we respond to things. And so psychedelics and ibogaine specifically help break up those neural pathways and then allow your brain to create new neural pathways. And so it's just like completely flips everything on its head. And then we're finding with the traumatic brain injury work that we're doing with these special forces veterans that there's some evidence of neurogenesis. So people who've had severe head injuries where so neurogenesis is like when your neurons actually like gain more of those kind of root-looking things and can like grow. And so neurogenesis isn't always good, and cancer is bad, and that's a genesis like of cells. And so, but we're starting to understand how these things work a little bit better. But the truth is that we don't really know exactly how all of this is working.
I think that's been part of the challenge of trying to engage the public in this movement and get their support, because we've all been brainwashed by big pharma to believe that the only medicine is creating a pill with one molecule targeting one receptor in the body, and suddenly you've got this situation where you've got this incredible medicine that's lighting up all different parts of the brain, and we don't have a clear mechanism of action. So the public is a little wary of it because they are worried that, how do we view this as medicine when big pharma has taught us this is the only way to approve a medicine. So we have some, a long way to go to get to the point where we actually have a clear mechanism of action. But the good news is I don't think the FDA is going to require that of MAPS. They're not going to require them to define the exact mechanism of action. All they have to define in FDA trials is can you prove the safety and efficacy? If we can prove that it's effective and very few side effects, then the FDA will approve it to be on the market, whether it's MDMA or LSD or psilocybin. So that's the good news. We still have a really clear path to getting this as a medicine on the market and to be eventually paid for by insurance companies. And I know that MAPS is already working on developing, in billing codes for insurance to actually pay for this treatment. So that's all really exciting.
Thank you. Congratulations to you. You guys are doing some amazing work, so it's pretty impressive to be here. My question is specifically about the current MDMA trials, and you talked about the male-female component and an 8-hour kind of therapy session. Once it goes past those trials, will that therapy be codified, and will that be the only way that people can experience that? And then what are thoughts behind how that can potentially modulate and change over time?
Good question. Yeah, so currently what we are passing is the entire 40-hour protocol. And so, you know, some therapists think that the protocol is not enough, and some therapists think that it's way overkill and that it will create a problem because it's going to be very expensive, and so it will create problems in terms of access to treatments. So I think the reason why we designed it in this way, and it's so stringent and robust in terms of you know what we're requiring, is so that we could get something that we know works, that we know is safe, and we can get it all the way through the FDA. So there's this larger conversation happening now, and there's a professional association that's in formation of people who are professionally working in the field of psychedelic psychiatry. And so the larger, I think, goal is that down the line, there'd be other types of training programs and other types of protocols that eventually there'll be a credentialing board that will be like a licensure board that will be able to examine all the available training protocols and then be able to approve the different training protocols and therapy protocols. But that credentialing board is going to be sanctioned by the FDA. And what the professional association is doing is from that professional association, that's where the credentialing board will emerge from. It'll be the experts and leaders in the field that will help the FDA determine that. But this is currently, right now, this is going to be the only way to access this treatment. And we're planning, it'll probably be maintained over those first 5 years. And again, it's because we care a lot about this rolling out properly. You know, if we have one bad thing happen, one bad therapist, it could derail this entire decades-long movement into creating access to these therapies. So, yeah. Cool.
Are we out of time?
No. We are, but no one's stopping us, so go ahead.
Okay, great, awesome. So first, again, thank you for all the work that you're doing. And Leanne, you probably know I'm like steeped in patents and stuff and the ethics of patents and that kind of thing with cannabis. And so I have 2 questions for you. One is, do you know if cannabis scientists have also agreed to this open science praxis? And if not, how can we get them involved? And then the second question has to do with social justice with regards to these indigenous people. You know, with 60 to 75% of the drugs that are on the market, they come from the practices and the plants that have been used traditionally. And I wonder if MAPS is thinking about, or Dr. Sisley, your organization is thinking about, how to use the patenting and intellectual property process to form a type of reparations to go directly back to those communities through the exclusive access that you're granting to yourselves.
It's a really good question, yeah. There's a lot in there. So first of all, not to my knowledge, I don't think any cannabis scientists have signed on to this open praxis statement. And it's a tough question because there is a strong case for creating patents. And there's 2 different things. First of all, the Open Cannabis Project has an anti-patent strategy where they've gathered over okay, I know what I know about it, maybe you know more, but they've gathered over 800 different genetic strains, and they put into the open public the genome sequencing of over 800 strains of cannabis. And I think their goal was so that people couldn't go and patent some like really traditional and well-held strains of cannabis. I might be wrong, maybe you can correct me, but, I want it, so yeah. Oh, right, that's what I thought. I thought that's, yeah. Do you want to talk about that at all? Because you're best in.
Sure. So,
yeah.
So what we're doing is we are creating prior art documentation for cannabis plants right now because we haven't had, MAPS is definitely working in some of the same prohibition-related sort of like mechanisms that the cannabis industry is working in, and so a lot of this work is done in the proprietary setting. And cannabis, you know, for other agricultural plants like corn and soybeans, we have a ton of public record and documentation about plants, which makes the patenting process and those questions a little bit more fair. For cannabis, why on earth would anybody in the past 80 years of prohibition put up their data in public record because, you know, for prior art documentation, when that could also be criminal evidence used against you? So there is a massive lack of documentation that's available to the public and the patent office, which is creating a massive unfairness in the patenting process. At the same time, there are questions that we're looking to answer, which are, you know, are there, you know, the software community, for example, has done something where, you know, they face a similar challenge with regards to patents, and they have now gone and done things like, you know, developers will get a patent, but then they'll sign an open license, so similar to this open praxis. And so part of what we're looking at and what we're going to be discussing with growers for the rest of the year is which of these strategies is the most ethical. And so, yeah, so that's what we're doing, and I know our website doesn't reflect it, and I'm fixing it, and hi.
Thanks for the update.
Sure,
Thanks
no
for
problem.
the update, for real, yeah. Because it's been a little while since we connected about that.
Totally.
Yeah, so we're facing the same exact question right now, because this question is, should we go out and get all the patents that we possibly can and do that and put it in the open source? Because if we don't, somebody's going to come down the line and do it. And so right now, MAPS has an anti-patent strategy, which is that, and it needs a little bit of work, so we should really talk, because we currently have on our website a place where people can submit their stories about MDMA and other things. So you can't patent the actual MDMA or really any of the classic psychedelics because they're in the open field. But you can patent for specific use cases, for specific indications. So there's a patent that was recently filed by this group that's been very mysterious and not open to us. And they filed a patent for LSD to treat Alzheimer's, right? And so that's like something that has occurred recently. We have a method of manufacturing patent has been filed for psilocybin by Compass Pathways. And so we're in this massive, very active and alive debate right now. And if you go to any psychedelics conference, this debate will be front and center stage right now around like whether or not that's ethical, around whether or not that's going to prevent people who want to manufacture at scale psilocybin for research. Are they going to now not be able to do that? And so these are very, very active and alive questions that are definitely unresolved. And so there's different kind of camps, and people feel different ways about it. So MAPS' strategy of like, everyone publish your story, and then it's like in the public record, and then you can't get a patent on it. That's good, but only goes so far. And so we're looking at ways to create like a more robust. And then, yeah, I mean, really the issue with going and filing a bunch of patents is it's so expensive. And so there's again, we're creating this professional association to try to have this like third-party community-driven group that's not, and like MAPS is not creating that. That's not a MAPS there is, the therapists are creating their own professional association, and I'm like fully on board. I think that's so important to be kind of the checks and balances to not only MAPS, but any other organization that might form and enter the space. So I'm hoping that like that effort can be more of a community-driven effort. And so that maybe we can come together as a community and raise the funds necessary to file the patents and then put them in the public domain. And I think that's yeah. Yeah. So
Also, I applaud your idea about the social justice fund. I don't know if MAPS has thought about that.
Yeah, well, it would be awesome if we like went and filed all these patents and put it in like, especially around like peyote and ayahuasca, and put it into the public domain. And then if anybody or like have, you know, so that the beneficiaries of the IP could be the tradition. That's a fantastic idea that I will definitely, we'll talk more about this.
Let's totally talk. I think about this a lot, and I think about,
Awesome.
and MAPS is my fiscal sponsor, and
Yes,
so
of
I
course.
want for us to be as in alignment as possible, so let's do it.
Awesome. Perfect. Cool. Well, I think that's about all the time that we have today. Yeah. Any other comments, ladies? All right. Well, thank you all for
everyone.
being here. Yeah, thanks so
Yeah.
much.